Yes, doctor.
So let's start. I think we're going to talk in the next session about schizophrenia. Schizophrenia is a very common illness. It's the bulk of psychiatric specialties, and it's one of the most severe and chronic disease that we have. Remember this very, very important slide. Schizophrenia is 1% of the population. So it is 1% in Riyadh, in China, in America, in Uganda, in Egypt, everywhere in the world, it's 1% of the population. So if you have 6 million in Riyadh, there is 60,000 schizophrenic here. It's very widely the same percentage everywhere. We have in the world like 72 million people with schizophrenia worldwide. It's very chronic and severe illness, debilitating. Usually it happens equally in men and women. So this is equal men and women, maybe male a little bit more. In female, it's a little bit later onset, like 25. And male is about 18 years old onset. It causes huge amount of financial burden on the family. So schizophrenia is part of illness that we call psychosis. Psychosis is a symptom, not an illness. It's like not like a physical illness or substance abuse, or it is like an illness where you live with your own world. You are out of touch with reality. So when we say somebody is psychotic, that means he lives in his own world. He see things that we don't see. He hear voices we don't hear, and he had feeling that usually don't happen to us. So he had disturbance in touch of reality. He feel things that we don't feel it. So schizophrenia is not like having multiple personality. That's an illness itself. Schizophrenia is having a separation between your thought and your feeling. So that's the word came from the Greek word. So schizophrenia, as we said, is common. 1% of the population cause financial problem. Suicide is very common in patients who are schizophrenic, and it happen in all socio. So if you are rich, or you live in China or Egypt, it's the same percentage, the same group. It has nothing to do with money. It can happen in any social group. The reason of schizophrenia is mutation. We're going to explain it a little bit. So mutation is mistake in the DNA. That's why most of the schizophrenia is de novo, means it happened without any family history, because it's related to SNP in the DNA. So any change in the DNA can put you at risk of of the schizophrenia. So it is both inherited and the gene and environment. So if you have gene of schizophrenia, you are more at risk of having schizophrenia. But if you have a stress and a little bit of gene, you can develop schizophrenia. So it's like having a jar. This jar will be full, whether it's too much stress that causes you to have schizophrenia, or too many genes without any stress that cause you to have schizophrenia. So remember, we are determined by our gene and our environment. So if you have one gene of schizophrenia, most likely you're not going to develop schizophrenia unless you have too many stress or environmental factor. But if you have too many environmental factor and have no gene, most likely you're not going to get schizophrenia. You have to have both gene, environment. So as we said, schizophrenia is a split of the mind. So your mind is fragmented. Your thinking is very fragmented. You are splitting away from reality. You live in your own world. So schis in Greek means separated from the reality in your thought and in your personality. And it's usually genetic and environmental, as we see, and leading to faulty perception. Faulty perception means I see things you don't see. I hear voices you don't usually hear. So putting it to schizophrenia on three things, like the pillar of Islam is 5, and the pillar of schizophrenia is 3. One is the positive symptom, where you hear voices, you see things, you have disorganized speech, disorganized thought. Positive means add symptom. For example, hallucination is a positive symptom. And negative symptom and cognition. Negative symptom is like anhedonia and inertia and isolation is called negative. Negative is taking away symptom. Positive is adding symptom. So, for example, if I say delusion is positive symptom. Isolation is negative symptom because it's taken out. And cognitive symptom. Cognitive symptom is the pillar of the schizophrenia. The patient with schizophrenia cannot think very well and cannot go well in school most of the time. Life is about having a wife or a husband, having a house, having kids, having money, traveling. All of that is, we call it schizophrenia life. In schizophrenia, you lose that important things. You are not able to establish life. You cannot get jobs very well, no money, no house. All what life about is not present in schizophrenia. You live in your own world. You live in a bubble. You think, you have a feeling that nobody share with you. You see a thing nobody see. You have a feeling inside you that is horrible and you cannot share it with anyone. You hear voices of the devil. You hear voices of people telling you what to do. You feel scared. You don't sleep. It's all a spectrum of schizophrenia. And it is 1% of the population. But if you have a cousin who have schizophrenia, your odds will increase by 1%. So you become 2. If you have a grandchildren, it will increase 5%. A half sibling, it will be 6%. Parent will be 6%. A twin will be 17%. Identical twin, although you have the same gene, but it's like 50%. And we're going to know why in a few minutes. Most of the schizophrenic are due to mutation. What is the risk factor for schizophrenia? I wanted to look at this slide and look at it carefully. So probably we are 193 students here. Probably 50 of you have schizophrenia genes, at least 50. But none of you have developed schizophrenia. Why? Because the gene of schizophrenia stayed locked. Like here, the gene did not open. So you don't have enough stress to open the gene and methylate the gene. So you call that gene methylation or demethylation. So a lot of people might have the gene of schizophrenia, but they will not develop schizophrenia. Why? Because the gene stayed closed, did not methylate. So you are fine. So one of the prayer I say for my kids, Allahumma don't methylate their gene. That's mean don't get them to have schizophrenia. What makes schizophrenia in those patients who had the gene for schizophrenia? Any life adversity. Life adversity means like you have the gene, but you have stress early in life, like when you were child, or you have a horrible thing happen, or you have a trauma in your life that caused you to have schizophrenia. So you have the gene, like Prophet said, al-fitna na'ima la'ana Allahu man ayqadhaha, means the bad thing is sleeping, the fitna is asleep, don't wake it up. So what happened in schizophrenia, there is some gene who were supposed to be silenced, then they were open and cause you to have schizophrenia. The most common thing that activates this gene is the stress and infection. So one of the lessons of life is that schizophrenia starts when you are 2 months in the second trimester in your mother's womb. So always when your wife or you girls, when you are pregnant between the month of 3 and 6, this is the time where the brain is developed. So any kids who had stress the mother during that time, they might get schizophrenia. So I always tell the husband is when your wife is pregnant between 3 and 6 months, you really need to pamper her, give her a good care, bring her flowers, chocolate, roses, because this is a time where your kid's brain is developing. So if you make any stress to your wife during that period of time, you're going to cause the child to have schizophrenia, God forbid. So always lessons for life: when you are pregnant, stay away from stress, because cortisone is what opens these genes. So when you are pregnant, especially in the first or the second trimester, make sure you have good life without any stress if you can. Most of the things that they used to connect with schizophrenia, like if the wife have any infection during that period in the second trimester. So make sure if you are pregnant, take the flu vaccine, because having the flu in the second trimester that might put the risk of your kids be schizophrenic. Reduce paternal stress, reduce teenage stress. Don't drink any alcohol or hashish when you are teenager, because there is correlation between drinking hashish or smoking hashish and marijuana and having schizophrenia. That will trigger the gene also. So make sure have when you are pregnant, second trimester, no stress, a lot of chocolate and flowers during that time. And then when you are born, take care of your kids. Don't let them go to drugs and alcohol or any severe stress, because that's what can trigger schizophrenia. Now, there is a lot of connection between schizophrenia and dysfunctional family. They found out that in a schizophrenic family, there is a lot of criticism and hostility. And we said in the first lecture, don't criticize anyone. So they found out that if you have a schizophrenic patient and you treat him and he get better, if he goes to a family where there's a lot of conflict and criticism, they will relapse. If you go to a family where there's no hostility and criticism, they will stay fine. So always when you meet with schizophrenic patient, bring the family in and tell them not to be criticizing and not to be hostile to this, because hostility and criticism will open that gene and make you have schizophrenia. Remember the epigenome. So any criticism, any hostility might open these genes and cause patient to have schizophrenia. Now, what is the risk factor mostly? Age of the mother or age of the father? Of course, it's the age of the father, not mother. Why? The mother, when a girl born, she had 400 eggs in her ovary. And she threw them once at a time for like 40 years, and they will be gone, and she will be fine after that. These 1,000 eggs usually are with her since she was born. They are not subject to the environmental change because they are there with her since born. The father's sperm always changing, so male makes sperm every day, and these sperm can be subjected to the environment. So if you live in a polluted environment, or if you have like alcohol or smoking, you increase the percentage of a mutation in these DNA of the sperm. And they found out that mutation or fragmentation in the DNA of the sperm is what causes schizophrenia. So what is the mutation increase in the sperm of the father is when they are smoking, when they live in a stress environment, polluted environment, or when they get older. So that's why if the father is old, the likelihood of having schizophrenia in the kids increase tremendously. That's why there is a way in United Kingdom now, boys try to save their sperm when they are like 50, or when they are 25 or 26, because the older you get, the more likely you can have a case with schizophrenia or with autism. So it's related directly to the sperm fragmentation, which increase with age. While the mother's eggs are stable, they don't get affected with the environment. So increase in mutation, that's why I see here, like if you are aged between 50 and 54, the percentage of schizophrenia become 1 out of 47. While if you are 25, the percentage is 1 out of 114. So it will increase with age. And the sperm fragmentation is what causes schizophrenia usually, one of the factors. So it increases with age, cancer, smoking, any stress in the environment. So I hope you understand that. What other factors? Childhood trauma. So most of the patients who had schizophrenia, look at their childhood, they have some kind of trauma or some stress that caused them to have schizophrenia. We said father's age over 45 increase the risk of schizophrenia in the kids. We said pregnancy and delivery complications. So any stress during delivery, pregnancy or complications, especially in the second trimester, increases schizophrenia. They have now connected to vitamin D deficiency. That's why patients who are were born in the winter, they have more risk of schizophrenia because there's not much sunlight. Urbanicity, if you live in Riyadh, you are 4 times most likely to have kids with schizophrenia. While if you live in a small town, it will be less likely. They might say because of social isolation. Migration. So if you live in Riyadh and you are not from Riyadh, you are more likely to have kids with schizophrenia. Migration increase or mental illness by at least 4-fold. Also, mother diabetes. If the mother have diabetes, the kids will have more likely to have schizophrenia. What is the pathophysiology? As you know, we have the gray matter and the white matter. The white matter is the brain cells here. The gray matter is the axon. So schizophrenia is a problem with the white matter. There will be huge.
Doctor, it's gone really quiet, your voice. No.
You sound very far, Doctor. Barely hear anything.
Okay.
Are you connected with Bluetooth headphone, maybe?
No headphone. Do you hear me now?
Or like, oh yes, now, okay.
Okay. So what happened is, if you don't hear me, please let me know. So what happened is there will be a drastic way of losing cells. Let me explain it to you a little bit more here. So the brain between age 12 and 15 go through pruning. Pruning is when you have a tree and every year you start cutting all the branches that is not making fruit. This is what happened in schizophrenia. In normal people.
Doctor, since the beginning of the previous slides, nearly we couldn't hear anything. Like your voice is disconnecting and then coming back. So it's like it's cut.
Let me ask my daughter to come and help me. Would you please come and help me, my daughter? Let's take a 2-minute break to fix it and we'll come back, okay? Do you hear me now?
Yes, doctor.
You hear me now better?
Yeah.
Shall I then?
Yes.
Doctor, could you be a bit louder, please?
Make it louder?
Yes, please.
Okay. Do you hear me now very well? Let me get it closer. Do you hear me well now?
Yes.
Better?
Mm-hmm. Yes, this is better, doctor.
Okay, so we'll continue. So during the first episode of psychosis, the brain goes through something we call pruning. Okay.
I a second ago you're very far from the microphone. Can you try
Yes.
again? I think this is good.
شوفي هذا في شيء. We are fixing the problem. Okay. ليش فجأة هيك صار؟ Yes, test. Test. No.
Yes, it's better.
Okay. Okay, we'll have a plan B in case. So what happened is the brain go through something we call pruning. Pruning is when the brain kill all the cells that he did not use in the early childhood. So it's like here, let me show you in the next slide. It's like when you are moving from Jeddah, you have a mansion in Jeddah and you're going to move to apartment in Riyadh. You're not going to take everything with you. You're going to take only the essential. And that's what happened to the brain. So between age 12 and 16 to 17, you will kill a couple of billion of brain cells. Why? Because you did not use them. That's why I always tell my kids, when you are a child, you can learn three languages and hafaz the Quran and everything. Why? Because you have plenty of brain cells. But by age 12, you start killing most of these brain cells that you did not use. So you kill about 20, 30% of the brain cells because you did not use them and you're going to take only the essential to the adulthood. The problem in schizophrenia, this has happened in normal patient. The problem in schizophrenia is you kill a lot more than 20%. So you lose most of your brain cells. And that's what we call the pruning problem in schizophrenia. So in schizophrenia, you prune most of your brain cells. When you look at the brain of schizophrenic compared with the no regular brain, this is the regular brain in the above, and you see that there is like 5% of the brain cells will be killed during that period. In a schizophrenic patient, over 25% of the brain cells will be killed, mainly in the area of the logic and the parietal lobe, where is the logical part of the brain, and in the temporal lobe, where is the limbic system. So this is a two crucial area where we lose brain cells, and also in the frontal lobe. So this is the area of the brain cells where we lose a lot of brain cells in that period. That's why in the new study done by Dr. Henry Nasrallah in University of Cincinnati, he said you need to treat schizophrenia like you treat heart attack, because once you see a patient with schizophrenia, the first episode, you need to start treatment as soon as possible. Is like you treat stroke. A stroke, if you delay the treatment of stroke, you end up with a lot of consequences. And schizophrenia is the same mechanism of stroke, but is a little bit slower. So now, when you see a patient with schizophrenia, you need to start immediately with the treatment. The problem in our society, when a patient become crazy and have a schizophrenic symptom, the family first take him to the healer, to the sheikh, يقرأوا عليه, do a lot of religious things before they bring him to the doctor. By the time they reach the doctor, half of the brain is gone. So that's why when you the future, what you need to do is have a pain-free treatment for schizophrenia. Schizophrenia need treated like you treat heart attack. Why? Look at the bottom here. This is after first episode of psychosis. Look at the brain. The branchings of the brain become a little bit smaller. The ventricle become wider. After a third of psychosis, the ventricle become much wider, and the parenchymas of the brain become smaller. After 8 episodes of psychosis, look at what the brain become like a patient with dementia. So by age 25, if you don't get quick treatment, you become like a guy who have Alzheimer. That's why they used to call schizophrenia dementia precox. Dementia precox means early dementia. Why? Because you get dementia when you are 25 years of age. You are destroying your brain. That's why the emphasis now is you need to be very aggressive in treating schizophrenia. Start treatment at the same time when you can. Like if I see a patient with psychosis, I don't give him prescription. I give him the medication right away in the clinic. Because even go to the pharmacy and come back is you're gonna kill about million brain cells at least. They said in schizophrenia you kill 19,000 brain cells in a second. Every second you lose 19,000 brain cells. That's why treatment of schizophrenia should be very aggressively. So after 8 episodes, your brain is gone. That's why we need to treat schizophrenia very quickly. See, when you have your first episode of schizophrenia, you recover, but you don't reach the same level that you had before. A little bit below. After a second episode, you lose like 25% of your brain, and then you go on and lose most of your brain. See, after 8 episode or fourth episode here, you lost quite number of your brain cells. That's why we said it's very essential to treat schizophrenia aggressively. And we said the loss of the brain cells start in the parietal lobe and goes down until they reach the motor area of the brain and the basal ganglia. That's why after 20 years of schizophrenia, you see the patient unable to walk and have movement problem because that's mean the brain cells damage had reached the basal ganglia, which is deep in the brain. But the most important part in schizophrenia is you lose your frontal lobe. Look at the frontal lobe in normal patient, look at the frontal lobe here. So the problem, what is the role of the frontal lobe? The frontal lobe is the logical part of the brain. So when you lose the logical part of the brain, your brain becomes crazy. And look at when you are in dream. When we are in a dream situation, our dream is very bizarre and illogical. Why? Because in a dream, the limbic system is very active and the frontal lobe is not active. The frontal lobe sleep during the night. The limbic system keep awake all the time. So the limbic system become illogical. The frontal lobe is the one part of the brain that make us logical and correct things for us and make us part of reality. That is the difference between us and the animal. The animal doesn't have a frontal lobe. We have a frontal lobe that what keep us in reality. I see a car, I see a window, I see a ceiling. My frontal lobe is the one that make me understand what's going on. If I don't have a frontal lobe, then I am out of touch of reality. Okay. How we diagnose schizophrenia? Schizophrenia start what we call prodromal stage, where a patient does not have a frank psychotic symptom, but have element of isolation, social withdrawal, illogical belief. Then they have the period where they start being psychotic, which is between age 18 and 32. This is the age we have the ups and down in the psychotic symptom, and then the patient will go to a residual stage where they lost most of their brain and become like institutionalized, and they have to live in a mental hospital because they will not be able to take care of themselves. So in the natural history, it starts insidiously. So the patient become a little bit illogical. They have odd feeling, odd behavior. They talk to somebody outside in an illogical way. You look at their history, they have problem in the pregnancy when mother was pregnant. They have stress in early childhood. In early childhood, they might be shy, a little bit withdrawal, trouble with the sleeping. Their cognition start to materialize around age 16, 17. They were like good student and then dramatically fall in their grade. So cognition is very big problem in schizophrenia. So this is what you call the eryprodrome. So in kids, as a kids, remember schizophrenia is like autism, same neuron, same chromosomes. So in the beginning, they will be in childhood, they might be isolated, they don't talk much, they don't show a lot of affect, they are slightly withdrawal, they don't cry or feel a lot of joy, their emotion is very restricted. Then they become a little bit forgetful. They either sleep too much or don't sleep at all. They have a flat affect. Their concentration is impaired. They cannot concentrate very well because of the cognitive problem. They might look robotic around 16, 17. They don't show any facial expression. Uh, they are socially awkward, withdrawal, some suspicion, some hostility. They are overeating or oversleeping or insomnia. They stop taking care of their hygiene, so their hygiene become deteriorating very fast. They stop going to school. They fail in school. They stay isolated in their room. Then, boom, they have the schizophrenic symptom, which is the psychosis. So this is the chronological phase of schizophrenia: anxiety, depression in the beginning, then social awkwardness, social withdrawal later on, and then the psychosis happen after that. Now, the most important part of that is when you see a kids who had great grade A in the beginning, they go to high school and their grade drop from A to D immediately. Those might be at risk of developing schizophrenia. They might be clumsy a little bit from childhood. They cannot hold things very well because the schizophrenia gene also had some connective tissue gene with it, so they might be clumsy a little bit, and the cognition is very important. So the pillar of schizophrenia, we said, is the three things: the negative, which is taking away things like affective blunting, they don't show any affect, inertia, no motivation, anhedonia, ovulation, cannot keep goals, they cannot do well in school, cannot focus. And then we have the delusion, hallucination, paranoia, which we call the positive symptom of schizophrenia. Positive, it doesn't mean that it's positive in per se. Positive mean it is add-on symptoms, not something good. Positive means add-on symptom that we don't have. Like me, I don't hear voices; they hear voices. I don't feel paranoid; they feel paranoid. This is what we mean by positive symptom. But the most important part is really the negative symptom because it's almost we don't have any treatment for it. So the negative symptom is when see the kids is isolated. Look at this guy with the glasses. He really have no facial expression, no feeling whatsoever. This is typical schizophrenic. A flat affect or an inappropriate affect. They usually have inertia. That means they don't want to do anything. They just sit and look at the ceiling for hours and hours. They cannot keep goals. They cannot do anything. Their family ask them to do anything. They cannot. They fail in school. They fail in their jobs. They have thought blocking. Like when you talk to them, they speak a little bit and they have a block of thought for a few minutes and then complete. So they have thought blocking. Their thought is not very, lenient like us. Uh, they usually have some anhedonia. They cannot enjoy anything. You take them to Riyadh Gallery or Riyadh Park. You buy them ice cream. You take them to the McDonald's. This is all what we can do in Riyadh anyway. But they don't enjoy anything, even those things they don't enjoy it. They have a problem in the DLPFC, which we said that there's a lateral prefrontal cortex in the brain, which is responsible for the working memory. This area of the brain usually shrink, so they cannot think, they cannot accomplish anything. They are socially withdrawal, ignoring their hygienes, losing of motivation, very common in schizophrenia, poverty of speech, poverty of verbal fluency. Those are the negative symptoms. Then the cognitive symptom is we cannot focus. They cannot learn anything. Like you bring a schizophrenic and he attend the lectures and he will not learn anything because their brain cannot comprehend. Their cognitive ability is very poor. They cannot focus. They cannot memorize. They cannot think very well like we do. And cognition impairment is seen in all aspects, in all phases of schizophrenia, even in the prodrome, in the final phase, and in the middle phase, we always have cognitive problem. Now, some of them might be able to finish high school and be a professor, but they have deficit in certain part of the cognition. Not all cognition are impaired. Certain part of the cognition will be impaired. So we can measure now with the fMRI to see how much activities they have in the DLPFC, because this is the start of schizophrenia where we see a brain damage here, because this is we can measure by asking patient to do some task and see how much activity is there. Usually, patient with schizophrenia have very poor activities in the prefrontal cortex, the lateral prefrontal cortex. So their working memory is impaired. They cannot do any complicated things because they are unable to integrate the information from the cognitive part of the brain to the decelateral prefrontal cortex. So this is what happened. They have deficit in this area of the brain. The frontal lobe is underactive, like we see here, and the patient have decreased motivation. Affect intensity is very poor. Emotional range is very poor. They don't have intense feeling. They cannot get sad or happy. They are always flat. They cannot communicate with you. They cannot sympathize with you. They cannot tell you I love you. They cannot show any emotion. They cannot make any decision because this area of the brain in the frontal lobe is underactive and it's not working very well. And they have impaired neuroplasticity. So it's like their brain cells is not making a lot of connection. You know, when when you hear my lectures, your amygdala and your hippocampus and your frontal lobe make a lot of connection between the brain cells. This connection is the information you learn from me. This is we call neuroplasticity. So if I measure your brain before you listen to my lectures and after you listen to my lectures, you will see a lot of connection you had made between the brain cells. When you make this connection between the brain cells, this is the knowledge you acquired and you store it in your brain. This we call neuroplasticity. So neuroplasticity is the ability of the brain to make a new connection between the brain cells. In a schizophrenic patient, they cannot do that. So look at the patient who are, when we talk about, we say the hippocampus is the part of the brain responsible for memory and comprehension of information, cognition. So this is the my hippocampus and your hippocampus in the above, very organized, put in a certain way, very clear, very organized. In schizophrenic patient, their hippocampus is out of control. It's out of order. The cell are left and right. They are not able to make any connection. So we call that impaired neuroplasticity. So that's mean if I bring a schizophrenic patient here, he will sit for an hour and not learn anything because he is not able to code any of this information in his hippocampus because he had no neuroplasticity ability to do that. So you bring a patient here and you put him in the lectures and their hippocampus will not change. On the other hand, your hippocampus, you are 176 people, your hippocampus has a change just by listening to me. I change your hippocampus or by listening to any professor because your hippocampus make a new connection. So I can change your hippocampus by listening to the lectures, but I cannot change your stomach because you need to eat to change your stomach. So I'm just kidding here. So we call schizophrenia patient have double whammy. What I mean by double whammy? Double whammy means not only they are unable to make a new connection, but the old connection they have, they are dying. So not only they cannot make a new connection, all of these old connection they have, what little information they have, is being going dramatically with the brain cell death. So that's what we call schizophrenia have double whammy. Double whammy means they cannot make new cells, they cannot make a new connection between the brain cells, and also what left of their brain cells is dying quickly. That's why they cannot learn anything. So this is what happened in the schizophrenia is a brain disease. It's affect all the brain, all function of the brain. So you see here the auditory system in the brain is impaired. They hear voices. The occipital lobe is impaired. They cannot see image very well. They cannot coordinate image in their brains. So that's why they see a thing we don't see, they feel thing we don't feel. The hippocampus is changed and they cannot learn anything because hippocampus is the part of the brain where we store information. Their limbic system is impaired, they become emotional and they become angry and they don't have intensity of the feeling. And the basal ganglia and the frontal lobe is impaired, so their movement is impaired and their frontal lobe is unable to function because it has no ability to solve any problem because their frontal lobe is out of control. So it's a whole brain disease that affecting all part of the brain. And the typical picture, the classic picture of schizophrenia is when we have enlarged ventricle. But this enlarged ventricle happen after many years of schizophrenia. So it doesn't happen if you have new schizophrenic, you will not see enlarged ventricle. You see it after many years of schizophrenia. So in the schizophrenia, we have excessive dopamine in the mesolimbic area of the brain. So it's called the area from the ventral tegmental area here to the limbic system called the mesolimbic area. We have high dopamine in this mesolimbic area. High dopamine in the mesolimbic area is what causes positive symptom like hallucination and delusion. On the other hand, they have low dopamine in the mesocortical area from the ventral tegmental area to the frontal lobe where we don't have the cell here start dying. So not having enough brain cells in the frontal lobe cause us to have the negative symptom of schizophrenia, which is social isolation and cognitive problem and enjoyment of life. So we have two things: positive symptom related to increased dopamine in the mesolimbic area, and negative symptom related to decreased dopamine in the mesocortical area. This is the two deficit in schizophrenia. So the treatment of schizophrenia always related to decrease the paranoia and delusion by blocking dopamine in the mesolimbic area. So all of the antipsychotic work on blocking D2 receptors, which is dopamine 2 receptors in the mesolimbic area. So we can treat the positive symptom, but we don't have any medication to treat the negative symptom. That's why we really don't have the ability to treat this negative symptom. We just treat the hallucination, the paranoia, and the delusion by blocking the dopamine in the mesolimbic area, which we call D2 blockade. What is the positive symptom of schizophrenia? We said the positive symptom is, as we said, hallucination, paranoia, delusion, disorganized speech. Disorganized speech is when the patient talk in non coherent way. So they keep jumping from one topic to the other. They cannot keep one subject together. They will talk incoherently about many things without being able to comprehend anything. So they jump from one subject to the other. They might have a new slang, a new language. Their thought is very disorganized. They cannot give you a meaningful subject. Like you ask him to give me a story, and he will keep jumping from one subject to the other, and he will not be able to give you a full meaning story. They have concrete thinking, like for example, if you ask him to give me a picture, and he will say, I don't have any picture to give you. So they think this is we call concrete thinking. They don't have the ability to think very well. Or if you ask him write a sentence for me, and he will write sentence, he cannot comprehend things. So they are concrete thinking. They look in very concrete way. The most common thing in schizophrenia, the hallmark of schizophrenia is hallucination. So a lot of the patient will have auditory hallucination, hearing voices that we don't hear. So the most common hallucination in schizophrenia is the auditory hallucination. Visual hallucination is common in delirium. Now, a schizophrenic patient might see things, might have visual, but the most common type of schizophrenia hallucination is hearing voices, auditory hallucination. This usually very bothersome for them. It causes them a lot of pain, a lot of tremendous amount of agitation, because the voices can be dramatic. Like these voices can be derogatory. Derogatory means they will say bad thing about him. Like they will hear voices in their inside their head. You are bad. You are stupid. They say some sexual thing for them. So these voices is very traumatic, and usually they are really hearing them. It's not like they are imagined. They are real voices inside their head, and they see things that we don't see. So I had one patient who see angel on the tree instead of bird, and hear voices of people talking to him like they are like I am talking to you now. So they are really live in their own world. And the other main common problem in schizophrenia is delusion. Delusion is a fixed mistake in reality. So a fixed belief that they are having this feeling and they cannot get rid of it. Like I remember one lady in long time ago, she had a delusion that she swallowed a cat in her stomach, and she used to go to the doctor, want to remove that cat. That cat she swallowed in her stomach is causing her a lot of anger and a lot of disability. So they have fixed delusion like police is after me, or I'm talking to an alien, or what we call conflict with reality. So this belief is not real. It cannot happen in reality. So they might see that like police is after me, or my wife is cheating on me, and they have this fixed belief that you cannot even discuss it with them. For them, it's a reality. I wrote you the most common form of delusion of persecution, where you feel people are plotting against you, you are under surveillance. Delusion of reference, where you believe, for example, that a newspaper is talking about you, or you see something and you feel it's directed toward you. Delusion of grandeur, where you feel like you are Al Mahdi al Muntazar, or God had talked to you and sent you a message. Delusion of erotomania, you see it sometimes in women. They feel like they are in a relationship with some movie star, and they have a real feeling about it. Delusion of jealousy, as we said, when you feel like your spouse is unfaithful. And many other delusion common in schizophrenia. So we have two kind of delusion. We have bizarre delusion, where it's really cannot happen in the real life, like you are talking to an alien. And non-bizarre delusion is like TV is talking about you. So, but delusion of prosecution, like you see in the movie Beautiful Mind, is the most common delusion in schizophrenia. This is delusion of grandeur, as we said, العظمة, and thought broadcasting, where you feel like people are able to read your brain. So the government spy on your brain, and they are able to read your brain. Delusion of reference, we said that when you see the TV is talking about you, or that movie is about you. Nihilistic delusion is when you feel part of you is missing. Like I remember one guy, I asked him in the mental hospital, why you are sitting, why you cannot walk? And he said, I cannot walk because somebody stole my spinal cord. So he doesn't have a spinal cord, he said. Delusion of control, where you feel somebody is controlling your brain. Uh, so diagnosis is very difficult sometimes, but you need to use some scale. So the most common scale we use in schizophrenia is called the brief psychiatric rating scale, BBRS, where it's a certain things you see in it: hostility, suspiciousness, somatic concern, disorganized, guilty feeling. You measure them and you put a score number for the patient to see how severe the schizophrenia is. And DSM-5 require you to have like delusion, hallucination, disorganized speech, and negative symptom as part of the equation. You have to have this symptom for more than 1 month. If it's less than 1 month, we don't call it schizophrenia, we call it schizopheniform disorder. But if it's more than 1 month, then it is a schizophrenia. Now we have to differentiate it from brief psychotic disorder, where you have schizophrenia symptom, but less than 1 month. So we call that brief psychotic disorder, usually for 1 month or less. Delusional disorder, we're gonna talk about it a little bit more. Dementia is same to the schizophrenia, the same symptoms sometimes, but dementia happen in elderly patient, while schizophrenia happen in young patient. Sometimes schizophrenia can be part of mood disorder. So some patient with depression might hear voices or see things, but the main issue here is the depression and schizophrenia symptom is add on. Why schizophrenia does not have necessary depression, but they have just psychotic symptom. Schizoaffective disorder is when you have both schizophrenia and mood disorder at the same time. Now, some patient with the after the birth of their child, they might have what we call postpartum psychosis. They hear voices for them to kill their babies, and sometimes they feel paranoid about it. So this is we call postpartum psychosis. Now, some people, when they drink alcohol, they become psychotic. When they use cocaine, they become psychotic. So we call that substance-induced psychotic disorder. Now we have to differentiate between delusional disorder and psychosis or schizophrenia. What is the difference between delusional disorder and schizophrenia? Delusional disorder, schizophrenia first, is most of the delusion is bizarre. Bizarre means it cannot happen in daily life. Like I'm talking to an alien, or I'm seeing the angel, or I'm hearing voices in my head. Those we call bizarre delusion, bizarre hallucination. In delusional disorder, that delusion can happen in daily life. Like, for example, the police is after me. It can happen in daily life. Or my wife want to poison me. A lot of wives want to poison their husband. This is normal. Actually, most wives want to poison their husband. This is normal feeling. So usually delusional disorder is the difference is delusional happen in the people who are 50 years old. Their personality is intact, so they can listen to our lectures and understand it. They can go to school, they can be professor, they can be a teacher. So their personality and brain is intact, but they have fixed delusion that either my wife is going to kill me, or my husband is cheating on me, or all of this, what you call delusion, that can happen in real life. While in in schizophrenia, the delusion usually cannot happen in real life. And the age difference, we said, delusional disorder happen in people in their 50s. Their personality is intact, while schizophrenia happen in 20s and 18s and 30s. Delusional disorder, the personality is intact. They don't have any odd behavior. They don't hear voices. They have no cognitive deficit, and they don't use drugs or alcohol. So this is important to differentiate between delusional disorder, which is quite common in the people who are, between age 50 and 60. Usually, delusional disorder also can happen in patient with dementia also in the beginning. So the treatment of schizophrenia is related to decreased D2 activities in the mesolimbic area between the ventral tegmental area and the limbic system. So all antipsychotic work on blocking D2 receptors in the mesolimbic area, like risperidone, olanzapine, amilsurpride, all of them do that. Final slide, I wanted to read it on your own. It's very important. At least there is two questions from this in all exams, like prognosis for schizophrenia. So if the onset is sudden, it's better prognosis. If you start early treatment, it's better prognosis. If there is no family history, it's better prognosis. Female is better prognosis than male. Fewer relapse is better than many relapse. So you need to know all of that. And that will be the end of our story. I'm sorry for the interruption. I hope you learned something. Please, 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 if you have any question, please send it to my WhatsApp. I'll be very happy to answer it. I'm very glad to help you with any way, shape, or form, and I will look forward to any question from you. I will listen to some question and answer, see if I can answer it now. If you don't get an answer, please send it to my WhatsApp, please. Thank you. Yes, schizophrenia, you can have bizarre delusion. Actually, most delusion in schizophrenia are bizarre delusion, but they can have bizarre and non-bizarre, while delusional disorder is only non-bizarre. So if you don't have schizophrenia and your so if you have schizophrenia, your grandchildren will increase to 5%. But most of the schizophrenic patients are de novo without any family history because of the mutation. Remember, the mutation is more important than inheritance. And mutation happen when you are older because the sperm become more mutated when you get older. Please watch the movie Beautiful Mind. It show you about schizophrenia. If you don't have time to watch it when you finish the exam. Yes, can manic phase be? Yes, it can be thought where your brain is running all the time. Doctor are the voices they hear negative because they have low self-esteem. No, schizophrenia is not psychodynamic. It's more like genetic problem. It's something wrong in the brain. It's like a stroke. It's something. Psychotherapy works for schizophrenia, but you need to get the patient out of the psychotic symptom. Then you do psychotherapy with him, but not in the acute phase. Yes, as we said, my one of my schizophrenic patient was one of the guy who did the atomic bomb. He was my patient. So you can be genius and schizophrenic. But why we say there is cognitive problem? Remember, cognition is many spectrum. So cognition is like 65 spectrum. So you have impaired in some of the cognition, but the other cognition part can be genius. So you lose probably your short-term memory, your concentration, but you are genius on other field of cognition. So there's cognition is many fields. If you send me a question on WhatsApp, I'll explain it to you. What is the cognition? Yes, manic phase and schizophrenia can be similar, and that's why you need to do the scale. So you do the Young Maniac scale and the BRSF, so you can differentiate between them, and you have good judgment. And the treatment is the same, so that's why the treatment is the same. Yes, some people might have mild, some people might have severe. It's depend on how many brain cells you lost. So that's why I'm saying that you need to treat patient quickly. If you treated it quickly, they might go back to be normal. If you delay the treatment, that's why some people might get lucky and get treatment as quickly as possible. Some people are not so lucky. They went to the sheikh and the healer, and then after that they came to the doctor, and that's why it's very hard to treat them when they reach that phase. I like your question a lot. Please send me any question. Don't be shy. I'll answer it. Okay, I will stop here. And please, if you have any questions, send it to my WhatsApp, please. Thank you.